Hi, I'm Mike Osterholm, former state epidemiologist of the state of Minnesota. Welcome to this year's annual CSTE meeting, a meeting that was always a highlight of my professional career during my days at the Minnesota Department of Health. Why am I here today? Well, I am a former president of CSTE in 1993-94, a whole generation ago, and I was there at the very first founding of the CSTE Executive Office in Atlanta with our first 2 employees. My, how times have changed. But really my main purpose to be here today is to thank you. To thank Sherry Davidson and the entire executive committee, to thank Janet Hamilton and the staff of CSTE, and to thank all of your team members back home, who basically were the backbone of our public health response to COVID-19 over the past year. It's hard to imagine what we've been through. You in particular know that very well. I never could understand how you were able to keep up in so many of the surveillance aspects of this disease, how you were able to handle the many political and deeply divisive issues that occurred during this time. I can tell you on behalf of a largely grateful nation, I say largely, we know the truth about that, we thank you for all that you did. I could never have been more proud of watching public health in action like it was with you. State epidemiologists and their relative appointed staffs were in fact so critical to getting us through this past year. So to all of you, thank you. To my own state epidemiologist here in Minnesota, Ruth Linfield, who I'm so very, very proud of, and what she did here during the course of this pandemic, thank you to you. We are not done yet, you know that. We've got more ahead of us, but hopefully we're over the hump, at least in this country. From a global standpoint, we have many, many more challenges yet ahead of us. But not for a moment do I want you to wonder if in fact your actions were understood, were recognized, and most of all appreciated. They are, they were, and they will be. Thank you again, and have a great meeting. I wish I could be there with you. Thank you very much.
Hi, I'm Pennsylvania Governor Tom Wolf. Welcome to the Council of State and Territorial Epidemiologists 2021 virtual conference. It has been an incredibly challenging year, and we've learned so much since the first COVID-19 cases were diagnosed in the United States. We're still learning more about this virus and its variants every day through the hard work of epidemiologists and public health professionals just like you. I've personally seen the dedication of our epidemiologists and public health professionals in Pennsylvania, and I am incredibly grateful for their work. I want to thank you for your dedication to protecting the public health, for all of the hard work you've done throughout the pandemic, and the sacrifices you've had to make. We have never seen such a data-intense response. Testing numbers, cases, incidence rates, percent positivity, outbreaks, deaths, vaccination numbers, all of these and more were captured, displayed, and debated on a daily basis. Here in Pennsylvania, this data informed our response and saved lives. You're the ones responsible for this much-needed data, and our nation would not be where it is now without you. I hope this conference gives all of you a chance to touch base with colleagues and decompress after the past year, but also to collaborate, to look ahead, and to explore how we can better prepare ourselves for the next public health challenges we'll face. Thank you.
Hello, this is Dr. Celeste Phillip, Deputy Director for Non-Infectious Diseases at the Centers for Disease Control and Prevention. This past year has been one of the most difficult for many of us, both professionally and personally. As epidemiologists, you've been on the front lines in your communities, collecting, analyzing, and explaining data to help make informed decisions to protect the health of your communities. There have been a lot of unknowns along the way. However, this pandemic has magnified the existing health inequities that many of you have been working to improve in your communities for years. This pandemic has also shined the light on the existing data infrastructure that is in great need of modernization. Along the way, we've been able to make enhancements that will greatly impact our ability to respond to another emerging threat in the future, but also looking forward to design the kind of system that allows us to have more real-time, accurate data on all kinds of health conditions, including those that are non-infectious. including better understanding social determinants of health and other underlying causes that contribute to the health inequities that we are all working to improve. So as we look to the future, as we look at the unprecedented amount of support and resources we are receiving to improve the data infrastructure for public health, we look forward to working with you to make sure that we are better prepared for the next emerging threat, whatever that may be. Please enjoy your time in this conference to reflect on the hard work, the lessons learned, and the impact that you've had in your communities to save lives. Thank you.
Hello, everyone. My name is Vivek Murthy, and I have the privilege of serving as Surgeon General of the United States. I'd like to extend my heartfelt gratitude to you, our nation's public health epidemiologists, who've done extraordinary life-saving work at the state, local, tribal, and territorial levels. Because I will always remember just how worrisome and scary it was during the early months of the pandemic, when all of our lives ground to a halt. We were dealing with a virus we didn't fully understand. We had no vaccine in sight, and we didn't know when the pandemic was going to end. Thank goodness we had you, because throughout those difficult days, you worked tirelessly, spending countless hours conducting case investigations, gathering data, analyzing it, and making critical recommendations. I know public health professionals may not be as visible as the clinicians in emergency rooms and intensive care units, but you proved to be just as vital to our nation's response. It is your work that made it possible to provide policymakers with science-based information that shaped critical laws and regulations. It is your evidence-based conclusions that led to public health guidance that ultimately succeeded in protecting millions of people in communities across America. That's why I want to say out loud something that you already know inside. Your work saved lives. I know you've had to do much of your work under scrutiny and strain, because at the same time that more people have begun to see public health experts as trusted leaders, others have made you the targets of their frustration in the form of protests, angry calls and messages, and even threats of violence. But even in the face of these challenges, you've stayed true to your mission to protect the nation's health. I'm grateful to you for your sacrifice and commitment. I know you didn't do it for praise or public recognition, but you absolutely deserve both, because you helped keep our country safe during the darkest hours of this pandemic, and we are all better off for your extraordinary contributions. The months and years ahead will be a transformative time for our nation as a whole, and for our public health system in particular. We still have more work to do to address the COVID-19 pandemic, but one of the lessons of this pandemic is already clear, that the work of public health epidemiologists will be central to our success in keeping the nation and the world safe. As leaders in public health, you are uniquely equipped to help us create a world where everyone can thrive in their homes, classrooms, workplaces, and neighborhoods. I'm looking forward to working with you and CSTE in pursuit of this broader vision. So thank you again for your courage, your resilience, and your selfless service to our nation. I'm so grateful for all you have done.
Warm greetings to you all. My name is Tony Fauci, Director of the National Institute of Allergy and Infectious Diseases and Chief Medical Advisor to President Biden. I appreciate the chance to speak to you virtually at the annual conference of the Council of State and Territorial Epidemiologists. Now, I know the past 17 months have been an incredibly busy and challenging time for all of you, and I want to thank you for your good work. During the COVID-19 pandemic, the importance of epidemiology and epidemiologists to our public health efforts has never been more evident. Some of you were among the first responders to the coronavirus pandemic in this country. From the early days of COVID-19, epidemiologists working at the state and local level have been immersed and the response, working long hours, often 7 days a week. You generated the data and insights needed to inform our public health and medical responses, and you always put science first. It has been a difficult task to provide guidance when so much was and is unknown, and to update recommendations as the understanding of the disease changed, week to week, and sometimes day to day. I suspect many of you have faced backlash because of public health recommendations related to masking and other mitigation measures. And I applaud you for being steadfast in following the science and for telling the truth, even if that truth was inconvenient. As we navigate the second year of the COVID-19 pandemic, we are all understandably exhausted from the way this pandemic has upended and constrained our lives. As a nation, we are currently walking a tightrope, balancing hope inspired by the brisk pace of COVID-19 vaccinations with realism that our work is not yet done. We must remain vigilant a bit longer to ensure that we finish this marathon race against the virus without jeopardizing the extraordinary progress we have made, and your work in achieving and maintaining that progress will remain essential. And so, thank you again for outstanding efforts during these challenging times. Please keep well and continue your good work. All the best for a great conference.
Hello, friends, warriors, heroes, applied public health epidemiologists. I hope you are having a wonderful conference this year, albeit virtual, but thankfully safe. And speaking of, I wanted to tell you thank you for keeping us all safe. And I wanted to say, I see you. And I know that you are exhausted. You are exhausted from doing what you have always done, but doing it at such a heated, high, scary, intense level this entire year. You are exhausted for fighting people for their own health, fighting people to do what's right for their own health. You are exhausted from taking time away from your families so that we can all, in this country and in this world, be healthy and have the vaccines and have the knowledge and information that we have. So I want to say thank you so much. Thank you so much also, Janet Jackson Hamilton, for reaching out to me so that I can say thank you to your wonderful peers and colleagues, and play for you this video that I made. I made this video at the top of the pandemic, and it's a part of my new record that's going to be coming out the end of June. And it is a message for you to say thank you and to keep up the hope, and that the sun will come out tomorrow. Thank you for what you do.
The sun will come out tomorrow. Bet your bottom dollar that tomorrow there'll be sun. Just thinking about tomorrow clears away the cobwebs and the sorrow till there's none. When I'm stuck with a day that's gray and lonely, I just stick up my chin and grin and say, oh, the sun will come out tomorrow, so you gotta tomorrow, come what may. Tomorrow, tomorrow, I love you. Tomorrow, you're always a day away. Tomorrow, tomorrow, I love you. Tomorrow, you're always